Now to the Capitol, where a new state health insurance option was unveiled. Political specialist Sean Boyd, of course, covering the Capitol for us. And Sean, this only applies to people who actually buy their own insurance.
Right, Karen, we're talking about 8% of Coloradans, but in the complicated world of health care, nothing happens in a vacuum. If this passes, it could impact health costs for most of us.
These are all of my bills after cancer.
Laura Packard says hospitals are making obscene profits off patients like her, and it has to stop. Representative Dylan Roberts agrees.
The Colorado option will hold corporate health care profits accountable.
Roberts, lead sponsor of a bill creating the Colorado Affordable Health Care Option, a public-private insurance plan. Here's how it would work. The state would force insurance companies to sell the plan in every county and every hospital to accept it or get shut down. It would also set reimbursement rates based largely on a percentage of what Medicare pays.
Now is not the time for tinkering around the edges and working on small policies to make small differences.
Only coming after hospitals for what is a much larger healthcare issue is tinkering around the edges.
Heidi Baskfield with Children's Hospital says government price controls could force hospitals to shift costs to employer-based insurance, driving up premiums for everyone. Insurers, too, warn of impacts, saying they will lose money administering the plan for the state. You think insurers will leave Colorado under this plan?
I think insurers are going to have to make very difficult decisions.
Roberts isn't convinced. The state option, he says, only impacts about 300,000 Coloradans who buy their own insurance now. He says those who switch to the state option will see a 9 to 20% reduction in premiums.
We cannot tell the people of Colorado that the status quo is okay. The Colorado option is the first guarantee that they will have an affordable choice on the individual market.
Now, if the bill passes, the goal would be to eventually expand it to the small group market and force down premiums for all of us. While no one has to switch to that state option, if they don't, they could end up paying even more than they do now. Most of those who buy their own insurance get federal subsidies, and those subsidies would drop if this takes effect. Bill sponsors are seeking a federal waiver to address that, and they're working on securing Republican support for the bill. Live at the Capitol, Sean Boyd covering Colorado First.
Sean, thank you.